Good afternoon, and thank you for joining us. My name is Tina Tebow, and I will be your moderator for this afternoon's news conference. Joining us today, the Honourable Stephen McNeil, Premier of the Province of Nova Scotia, and Dr. Robert Strang, Chief Medical Officer of Health for Nova Scotia. Go ahead, Premier.
Thank you, Tina, and good afternoon, everyone. Today we are announcing 9 new cases of COVID-19 in the Central Zone. One is a case of a student at the Bedford South Elementary School. The student did not attend school today and is self-isolating, and the school is closed for deep cleaning and while contact tracing is underway. I want to reassure everyone that the Department of Education and Public Health are working together to manage this situation and to ensure the safety of our staff and students. We're also working hard to keep the staff and long-term care residents safe as well. That's why today we are starting a testing strategy in 3 of our long-term care homes. Dr. Strang will have more to say on that and provide details of some other concerns that he has. I'll tell you what I'm concerned about, though. People reading too much into social media threads about cases of COVID that do not exist. We have to be mindful of the facts. Public health is working tirelessly to track and trace COVID. We need to let the professionals do their jobs and not allow rumors to distort the facts. I want to thank those who are working in our labs and volunteering to do testing. You are among the busiest people in our province, and we would not be getting through this without you. We are days into new restrictions placed in parts of HRM in Hants County, and I want to thank the businesses for the cooperation after they've been ordered to close. And I want to thank everyone for working with us to follow these new measures. I am a bit concerned because this is normally a big shopping weekend. Not this year. Don't forget, we are strongly recommending that you travel for only essential purposes. And I'm sorry to say, shopping's not an essential purpose. If you want to buy this weekend, buy local. Wouldn't you agree, Dr. Strang?
Absolutely. Buy local and buy online. Thank you, Premier. Good afternoon, everybody. As the Premier said, we are reporting 9 new cases of COVID-19, all in the Central Zone, and that's including the case that the Premier just talked about, reported today at Bedford South School. Public Health will be in touch. There's been communication out to the school earlier today, and Public Health will be in touch with close contacts as part of their ongoing investigation to give more information and outline next steps for those individuals. We have nobody in the hospital right now, and there are no cases in long-term care, and we really hope to keep it that way. In total today, we have 118 active cases. Since October 1st, there have been 175 cases in total. 57 of those are now considered resolved. And we are, in retrospect, we're looking back, we've identified October 1st as the time when we say that was the start of the second wave here in Nova Scotia. So for anyone who's interested in all the cumulative data, the numbers that we've had from the beginning of the pandemic, those will be on the website. But moving forward, I'll only be sharing numbers from the second wave. All the numbers from the first wave are there on the website. Right now, the team at Public Health has 1,058 open investigations, and many of them are complex investigations. Each positive case the lab is identifying has an average of 7 close contacts, but many of the cases have a lot more than that. Putting this in perspective, a week ago we had 276 open investigations that Public Health was following up, and there was 5 to 6 close contacts per case on average. When our case numbers are consistently low, 2 or 3 cases per day for quite a long stretch, we are able to go much deeper into each case and do that much more quickly. And close contacts get notified almost right away. But as we are now, when the number of investigations nearly quadruple over the course of a week, everything gets more complicated, everything takes more time. So if you know you're a close contact of a positive case, so somebody that you are very close contact with through work, you live in the same house, you were out at a social gathering in very close contact with that individual, if you're in any of those situations and you haven't heard from Public Health yet, This is why we are getting to people as quickly as we can, but the volume of work is immense. And I do want to recognize all my colleagues on the front lines in public health and the work they're doing right now to help us stay on top of controlling the second wave. So thank you to my public health colleagues. So I ask for people's support and patience during this. Public health will get to you. While you're waiting, if you believe you're a close contact, just stay isolated at home. We need your help on this. You will get a phone call. We'll get to you as soon as possible. I recognize that is challenging for people, but we are working very diligently to get on top of this. As I said last week, at the last update, that I would expect to see the number of cases rise for the next week to 10 days. And I am certainly relieved to see that we've actually somewhat stabilized. We have 8 cases today, 14 yesterday, and 16 on Wednesday. That's been a pleasant surprise. Excuse me. But we can expect to see high numbers of daily cases over the next week to 10 days. There's a lot of good work going on right now to contain the spread of the virus, but we were just day 2 into implementing our tight restrictions in the Halifax area, so we're by no means out of the woods yet. All Nova Scotians need to stay vigilant. We need to continue to closely follow all the protocols everywhere in the province. Wave 2 is clearly here in Halifax, and we're trying to keep it in Halifax. But it could spread beyond that area, so we need all your help. And that's why it's critically important that when we say only essential travel for work, education, healthcare coming into or leaving the Halifax area, we mean that. Non-essential travel should not happen. That is how the virus will spread, through people traveling, not taking precautions, coming in unnecessarily. Earlier today, the town of Wolfville announced that researchers from Acadia, Dalhousie, and Lumen Ultra Technologies had detected COVID-19 in the town's wastewater. This wastewater testing is part of an ongoing national research. It is experimental, so this is not definitive confirmation, but it could be a signal that COVID-19 has made its way into that community too. So it highlights the importance of everybody following the public health measures, no matter where you live in Nova Scotia. Wear your mask, wash your hands, keep your distance from others, keep your social circles and your gatherings small, and stay home if you're feeling unwell. These are the things that we can all do right now to keep ourselves and each other safe. And in response to the finding in Wolfville, we have increased the capacity at the Primary Assessment Centre in Wolfville, and I want to recognize the rapid work by the Nova Scotia Health Authority to do that. And we're also planning to have one of our pop-up rapid testing sites in place early next week. So let me talk a little bit more about testing, because there is a lot going on. There's been a tremendous amount of good work, but there's also some confusion as well. Our testing strategy is very different now than it was in the first wave of the pandemic, different even than it was a few weeks ago. We've broadened our focus from testing people who have symptoms of COVID-19 to testing a large number of people with no symptoms. This has to do with the ages and behaviors of the people who are testing positive right now. And for us, that's the 18 to 35-year-olds. When I say that, I want to be clear, this is not a judgment of anyone in this age group. The vast majority of people have been following the rules. But even within these rules, the virus can easily spread from person to person through the social activities. And especially with COVID, we know that many people have no symptoms or very mild symptoms. So, as I said at the last briefing, the term that Dr. Barrett uses, this is a stealth virus. So with no symptoms, the only way to find people infected with COVID-19 is to test them, and test a lot of people. So earlier this week, we asked anyone who works in or went to a late night bar, and that's after 10 p.m., which for me is a late night anyway. Anybody who works in or goes to that late night bar or restaurant in Halifax, we are asking you to go online and book a test, even if you don't have any symptoms. And we've had an unbelievable response to that call to action. We've had nearly 8,000 people come forward. Our healthcare system partners, and again, kudos to the health authority, have worked extremely hard to quickly ramp up to meet these demands. They have stood up an entirely new testing stream almost overnight, and that is no small feat. I also want to recognize the great cooperation from HRM and the ability to use the Zatzman Sportsplex in Dartmouth. With the demand for testing so high, it is taking some time for people to get booked in for testing, but we're working through as quickly as possible. If you did go on to do the online assessment for asymptomatic testing, you will get a call back with an appointment. It just may take a little bit of time. Please don't call 811. They're going to tell you exactly the same thing as what you read initially on the website to book your appointment, to wait for somebody to contact you with an appointment. We need to keep 811, the line and the staff available to deal with more urgent issues and to book tests for people who do not have access to the online tool. So for bar staff and patrons who have recently been in the late night Halifax establishments, as long as you don't have any symptoms and you're feeling well and you don't develop symptoms while you wait, you don't need to self-isolate at any point during this process. Go about your life following all the careful COVID protocols that we all need to be doing, and you will get contacted soon to arrange for your testing. There may be a few exceptions in this. For example, healthcare workers have particular rules because of the higher risk in a healthcare environment. So they should follow the rules that are established by their employer about what they need to do. We're also asking anyone who was exposed to COVID-19 in the community, and those are the places that I'm sure most people are familiar with now, the regular notifications that if you've been in this place at a certain date and time, you may have been exposed to COVID-19, then you need to go get a test. The way you go get a test is to use the self-assessment tool and book yourself in for a test, even if you do not have symptoms. If you're one of the people on that list, if you're responding not to our general call, but if you're responding because you fit the criteria and you were in one of the establishments where there's a specific date and time, you do need to self-isolate while you're waiting for your test. So what we ask you read those exposure notices carefully, and there's all the information on the exposure notice that will tell you what to do. And if you go to our coronavirus website, that's novascotia.ca/coronavirus, there's all this information is laid out for people as well. The online self-assessment tool will also give you instructions on how to self-isolate. So when you go there, please make sure you read those pages carefully. So we are working as hard as we can to get back to people as soon as possible. We know people wanted to get their appointment. We know people need their results. But as we're dealing with unprecedented numbers of people, and as we've rapidly building capacity in the health system, we are asking for people's patience. We're very much building the plane and flying it at the same time when it comes to this asymptomatic testing as part of our outbreak response. So again, your patience is appreciated. In addition to all that, there's a brand new testing stream that you may have seen or heard about downtown over the last week. Doctors Lisa Barrett and Todd Hatchett and their teams were at the Liquor Dome last weekend. They spent a couple of days at Dalhousie's Sexton campus, and this afternoon they're at the Alderney Library in Dartmouth. The turnout for these pop-up sites has been, quite frankly, nothing short of amazing. Since Saturday, the team has performed more than 2,700 point-of-care rapid tests. Yesterday alone, there was 1,100 people who were tested. But people need to understand that this is a less accurate test. It has a place. It's very important. But these rapid point-of-care tests do not replace the need for a standard test. So if you are, as I talked about earlier, if you're one of the bar staff or patrons who'd recently been in a late night Halifax establishment, or you're somebody who's responding to an exposure notice, you still need to do the online self-assessment to book a standard PCR test. The pop-ups are meant to provide access to testing for anyone over 16 who isn't in one of the two groups that I just talked about. The reason that is that the use of these tests is to rapidly test lots of people, looking for people who might be positive, especially, and then we're getting a sense of what have we been missing for a more standard approach. But they're less accurate. There is a higher risk of both false negatives and false positive results. So that's why when we do these pop-up tests, anyone who tests positive then also has another swab done, which is then sent also to confirm it with the standard PCR testing. And if your test is negative, it essentially tells you you're negative right now. It gives you no prediction about what your likelihood of perhaps being negative the next day. So the information you get is really valuable to help you govern your behavior around the time you get your test. And it's very helpful for us to identify people who may have no symptoms at all, but are positive. And we are identifying about 0.4% of our tests are actually positives who had no idea they were positive and then had no symptoms. That may seem like a very low number, but each of those cases, if they had continued to do the things they were doing, they would have potentially exposed dozens of other people. Then each of those potentially then get infectious and then themselves expose other dozens of people. So you can see how we can have a cascading effect. So the value of these rapid tests as part of our overall testing strategy is important. And I want to thank Dr. Barrett and Dr. Hatchett for leading this work. They have mobilized a large number of volunteers from the Dalhousie community and other places, and I want to thank all of those people who are coming out to volunteer, the support from Dalhousie, NSHA, and HRM, supporting them with facilities and in other ways. And I want to thank the thousands of people who have been showing up for that, for being patient, being patient with the lineups, and we've seen many comments about people saying, I know I need to get tested, not just for me, but I need to do it so I can know what my status is as part of helping keeping the rest of my community safe. It's been quite inspiring to watch that. What we've done this week on the surface may look easy, but I assure you that the work that's necessary behind the scenes to do this is not. It's been an amazing effort to stand up all these testing sites, as I've said, for the different purposes, the logistics, getting the people involved, the materials. So there's a huge number of people that deserve a huge amount of thanks for that. And this is actually being looked at. We talked about this on my national call yesterday, and people across the country are looking at this model in Halifax with a lot of support for us, and they're really looking at it as something that they can learn on. So this model is actually leading the way in many ways about how we, along with our very quick application of our tough measures, restrictions, it's been looked at as a model of how we need to deal with early on with emerging clusters of COVID in communities across the country. Today is also the first day of our serial testing in long-term care. This is part of our effort to monitor, reduce, and prevent the spread of COVID-19 in long-term care facilities, and none of us need a reminder about how important that is. So we'll be testing volunteers, designated caregivers, and employees who provide direct care to residents every 2 weeks. We've started today at 3 locations, Northwood, Ocean View, and St. Vincent's. We'll be adding 6 more facilities over the next 2 weeks, and then we'll continue to add further facilities from there. I'm going to shift now to talk a little bit about vaccines. That's the COVID vaccine has certainly been in the media the last couple of days. Lots of interest. Yesterday, the federal government provided an update and said they were anticipating that we would be able to begin vaccinating Canadians early in 2021. That's an important commitment from the federal government. At this point in time, though, we need to understand where we're at. There are 140 potential or candidate vaccines worldwide. And in Canada, the federal government is moving forward and has arranged procurement agreements with 7 manufacturers. However, none of these vaccines has been licensed yet by Health Canada, so we have no certainty at this point about the availability and the amount. We are working closely with the federal government, but we do expect to see small amounts of vaccine as early as January. But I need to be clear, we are expecting very small amounts to begin with. So it's important that people understand when we get vaccine, we have tightly control the supply and a very strict prioritization of who that vaccine needs to go to. It needs to go to those who it'll have the greatest benefit and those who are at the highest risk. There is more detailed guidance. We're following guidelines on prioritization from the National Advisory Committee on Immunization, and we're working with them, and they have high-level guidance, and we're now working with them to produce more detailed guidance, even within their initial groups. It's important that we follow those along with all other provinces and territories and have a consistency about how we prioritize for that vaccine. So in the weeks ahead, we'll be working to understand who gets the vaccine first within the national guidance framework, how it will be transported and stored, and how it will be delivered. Each of the potential vaccine candidates, there's different requirements around the temperature it must be kept at and keeping what we call the cold chain maintenance so the vaccine remains viable. And because of those different storage and handling requirements, it requires a different model of delivery potentially, and who we choose as the risk groups also depends who are the best people to be providing that vaccine. I know people are looking for more information on this. We're starting this week. We've started more detailed conversations within the provincial government, and as we get more certainty from the federal level and develop in more detail our vaccine program plans, we will bring them here and make sure all Nova Scotians are aware of those. We're 2 days into the new restrictions in the areas of HRM and Hants County, and I want to take a moment to thank everybody for doing their part on this, because the amount of correspondence I've received of people very supportive of this, even those who are directly feeling the economic impact, are all, by and large, everybody's indicating their support. So for those in the retail sector, I know that we have asked a lot of people in terms of implementing the restrictions in a very short time frame, and I want to thank them for stepping up and helping keeping everyone safe. To the restaurant and bar owners, we again asked you to pivot your service to only takeout and delivery, and you did that very willingly. I know that's not easy, so thank you to all the restaurant and bar owners. We also offer to all Nova Scotians, we're asking you, as you said, the Premier and I have said earlier, to avoid travel, not just in and out of the province. That's important. We were asking all Nova Scotians to stay closer to home, to only have essential travel to any other province. But also we're asking you, as we said, within the province, essential travel in and out of Metro, HRM, and the Enfield, Elmsdale, and Mount Uniacke. It's critically important that we all do what we need to do to keep the COVID-19 wave 2 as in the limited geography and don't give it a chance to spread beyond. So travel for work is essential, travel for school is essential, travel for medical care is essential. But what's not essential is to go shopping for gas and groceries, to get together with family and friends, play sports or other activities. If you're doing those, please do those close to home. I know this isn't easy. It's hard, especially at this time of year as people are anticipating the holiday season. But like I said at the last briefing, hard is not impossible. If we all buckle down together and do the hard work, we will be able to stop the spread of this virus, and we'll be able to stop it early. So if you must go out, please obey the travel requirements and continue to follow all the public health measures. And I do recognize that the holiday season makes these restrictions even more challenging, and that's why it's even more important that we take good care, each of us, of our physical and mental health. The things that are going to keep us healthy during this time are the ones that will keep us COVID safe as well. It may sound somewhat trite, but it's true. People need to prioritize sleep. Find ways to maintain your social connections, even if you can't do it in person. Maintain a healthy diet and make time for exercise. A walk outdoors is great. Fresh air is wonderful. But I also know that there are many local operations offering online fitness classes for free. This may sound like stereotypical doctor advice, but these things are important. So do the best you can do. These will impact your physical health, but we also know all these things are good for your mental health. And certainly COVID and these public health restrictions, we know how they're challenging people's mental health. Making sure that you follow the COVID protocols, plus developing a personal COVID plan, if you will, can give you a sense of control, which is an important way to reduce fear and anxiety. So a personal COVID response plan may include things like, what would I do if I need to self-isolate? How can I stay connected to family and friends when I can't see them in person? What do I do if schools or daycares are closed? So rather than worrying about those, I encourage people to also develop a plan, because we know from basic psychology, if you have a plan and you've thought about it, you're giving yourself some sense and control, and that will help. The fear and anxiety will help your mental health. At this time, I want to emphasize we do not have any plans for further restrictions, and I firmly believe that as long as things stay where we're at, that being in classrooms is the best place for our children. But we will, if necessary, make changes, whether it's geographically spreading where the restrictions or tightening restrictions down. Unlike in the first wave, we do have more time to think about and plan in advance how we deal with these situations, and we are prepared. We have the plans in place if necessary to go further. But I truly believe that if for the next 2 weeks, following the restrictions, we may have to expand them further. But if we, at least for 2 weeks, and the success of our testing that continues, that we are putting ourselves on the best possible path to be able to start loosening restrictions as early as possible, which then puts us in the best possible path to start with economic recovery as well. As I said earlier, our approach right now, acting early and aggressively to stop the second wave, is being watched across the country. I recognize that acting early and aggressively is tough, and we recognize the challenges of this situation. We are asking of a lot of you, but I'll repeat again, it's hard, but hard is not impossible. So we can make this just a little bit easier for all of us if we know that each of us are doing our part, each of us are looking out for each other. So I encourage you that I hope, and my hope for each of you, that this weekend is a good one, whether it's cozying up with a book, playing games with your family, getting outside, exploring your neighborhood, much like we did in Wave 1. Do some online shopping or shop locally. Now is the time to support local Nova Scotia businesses, whether it's by shopping locally or online shopping. And please stay close to home. Premier.
Thank you, Dr. Strang. I think I like that prioritizing sleep one. I think it might be the one for the weekend. I just want to say, before I turn it over to you, Tina, many of you see Dr. Strang here on all of our briefings doing the work, communicating to you what's happening inside of Nova Scotia and the work that public health are doing here. I want you to know he's a strong public health voice for our province on the national scene when we're dealing with vaccines and dealing with the distribution, ensuring that as we prioritize who will receive this, it will be focused on, it will be public health officials who will determine that order across the country and consistency. And you all, I know how proud of him you are and how grateful we are to him, but I want to tell you, I get a chance to watch him up close at the national scene, and he represents you and our families very well on the national scene. So on behalf of all of us, Dr. Strang, thank you.
Thank you, Premier.
Tina.
Again, just a reminder, we'll take one question and one follow-up from reporters on the line in the allotted time that we have today. We'll start with Natasha Pace from CTV. Go ahead, Natasha.
Thank you. Premier, you had a call with the Prime Minister last night about the vaccine rollout. Were there any concerns you took away from that call? And can you kind of detail a plan and timeline for the vaccine rollout here for us?
So Dr. Strang just laid it out in his remarks. We wanted to make sure that it's distributed on a per capita basis across the country, that it would end up having consistency on how it's rolled out. They would set with the support, obviously, of our public health officials across the country to prioritize who would get it first, and we, as provinces, would administer that. There is talk of some early vaccine early in the new year, but I just want to caution everyone, as Dr. Strang said earlier, we need to manage expectation here. The quantity of that product, none of it is actually is ready to be put in our marketplace right now. But I want to reassure all Nova Scotians, the federal government, working with their partners provincially in public health, are laying out those protocols so that when it arrives here, we will be able to distribute it and be able to provide it to the citizens in the order to which public health advice will give us to do it.
Go ahead with your follow-up, Natasha.
Thank you. Premier, yesterday New Brunswick also pulled out of the Atlantic bubble, so I'm wondering if you can clarify what that means for us in Nova Scotia. Do folks from the other Atlantic provinces have to isolate when they come into Nova Scotia now?
No, we're going to continue with the rules that we had around the Atlantic bubble, but I think we're being very clear to everyone, unless it's an essential trip here, stay home. Shop in your own province, stay home in your own property in your own province, but we're very conscious of the fact that in our first wave, we reduced our healthcare system. Any elective surgeries were changed, appointments would have been canceled, all of that. We want to make sure that as we deal with the second wave, we continue to let our healthcare system, our acute care system operate. So when our sister neighbors come into our province, whether it's for medical appointments or some other essential service, they will not have to isolate if they are within the Atlantic provinces. All of the other restrictions on the rest of Canada would still hold. But my advice to Atlantic Canadians is to stay home, just as Dr. Strang and I have said to Nova Scotians, stay in your own communities in this province. Let's let this be a weekend of spending a lot of time in our own neighborhoods and our own properties.
Next, we'll go to Keith Doucette from the Canadian Press. Go ahead, Keith.
Hi, Premier. Yeah, it is our first opportunity to talk to you since New Brunswick pulled out, and you've just kind of gone over things a little bit there. But I wanted to ask you about, what does this say about the Atlantic bubble overall? Is the fact that it's now basically burst a sign that it failed, or do you feel it's a success and it's something we could return to fairly quickly?
Oh, I think it's been a huge success in many ways, and to be perfectly frank, it's been a huge success for the mental health of Atlantic Canadians. I don't have to remind all of you, when we were locked down within our own provinces, the anxiety of summer coming, people worried about not seeing their families next door in their neighboring provinces. I think when we provided that Atlantic bubble, you felt the level of anxiety disappear from the citizens. I think what you're seeing is in some cases where we had an outbreak, the respective premiers and public health officials felt it was better that they would take the step of going to that 14-day quarantine for everyone. We've just felt, to be honest with you, the issue of the essential service component, essential travel was able to be managed. And we're really asking people, let's just slow down our movement here. If you have to come, you're welcome to come. But other than that, stay home and do your shopping, do whatever else it is you have to do at home. Because, quite frankly, I think it's fair to say, Dr. Strang, in the first wave, we didn't know, and I think across the country didn't know what was going to happen with our healthcare system. We're trying to keep COVID out of our healthcare system, but we're also recognize we canceled many elective surgeries and appointments that people need, and we want to try to make sure that those services still be available as long as we can. But if something were to change, if we saw an outbreak, we would respond to it.
Go ahead, Keith, with your follow-up.
I don't think actually anybody would argue with you on your point about it being an overall success, but I'm just wondering what lessons you've come to realize, because if you recall, in early July, as early as July, you were talking about the possibility of perhaps even opening up to the rest of Canada. Yet here we are in November. I wonder if you can just give us some thoughts on that.
Yeah, I listen. There's no question I wanted to open up. I've been saying all along we have to learn to live with COVID. I think it's fair to say this second wave is a little different than the first one, particularly around asymptomatic people. So, the fact that we need to step up the rapid testing model that we're doing, I think. You're seeing the pilots happening in Alberta. That's with international travel. You're seeing some work that's happened at Pearson in Toronto. I think it's. I can tell you that we won't be opening up to the rest of Canada anytime soon. And if we do, and when we do, the model that we're seeing around the rapid testing piece here currently today in Nova Scotia would have to be definitely part of that opening up.
Next, we'll go to Mike Gorman from CBC. Go ahead, Mike.
Thank you. Dr. Strang, what does being able to conduct tests at the level that we've reached in the last couple of days do in terms of our ability to try to catch and contain spread in the Halifax area?
It's critically important. So as we've tightened everything down, we really know that we probably had for 2 or 3 weeks unrecognized spread of COVID before it really started to take off. And even now, that even as I said, of the 0.4% of people, again, that seems like a small number, but that's a number of cases, and each of those in the context they may have. So what we're doing now, while we're keeping everybody, the restrictions, which slows down everybody's movement, decreases the chance for the virus to be spread, we're investing in the testing, and what that does is to identify as many people as possible who are these asymptomatic individuals, test them, get them isolated, and so by the time allows us to get a much greater handle on where the virus is, and then control its spread through the restrictions. It's the combination of the two that'll allow us to start to slowly reopen. But it's the restrictions wouldn't work on their own. The testing wouldn't work on its own. You have to do both together.
Go ahead, Mike, with your follow-up.
Dr. Strang, specific to the introduction of the rapid tests and the different ways they're using, I'm wondering if you could talk a little bit about the way the thinking evolved on that, because even as recently as just a couple of weeks ago, it was uncertain when or if they would be used, and now they're being used quite thoroughly. And keeping with rapid tests for a moment, I note that you're starting with long-term care homes that are in HRM. Is the intention for now to only do rapid testing in HRM long-term care homes, or is your expectation that that will expand outside of the area even if there is no sign of spread there?
No, we certainly mean to roll that out across the province as adding another important piece to using testing along with all the other measures to make sure we have the most protection possible of our long-term care facilities. To your other point, I think what we're seeing is that the best place where the rapid or the point-of-care tests, their role is really critical when in the event of an outbreak. We weren't in an outbreak 2 or 3 weeks ago, and it's due to the lower accuracy of the test that makes it less valuable when you're not in an outbreak situation. But certainly, as we're seeing now, using that in combination with other testing streams that use the more accurate PCR, you put those all together. That is that access to testing in different ways, and we're targeting different populations. Populations that are of higher risk of having COVID, you really want to make sure you're using your more accurate PCR test. But for the general population, using this rapid test, you can get through large numbers of people and without having all the infrastructure that the PCR test requires. We have to acknowledge, though, that the reason we're able to do these pop-up testing sites is simply because we have a significant number of volunteers who have come forward to do this. So this is, it's not a long-term solution. You use it in a very focused, time-limited manner as part of an outbreak control.
Next, we'll go to Graham Benjamin from Global. Go ahead, Graham.
Thank you. Just a question for Dr. Strang on those rapid testing centers. As you mentioned, they're really seeing a tremendous amount of people over the past 3 days, especially those in the 18 to 35 age group. But with the request earlier this week to have anyone in the HRM who's gone to a bar in the past 10 days to go through 811 for a standard test rather than the rapid test, are you concerned about the amount of people who may have gone to a bar in the past 10 days who got the rapid test instead of the standard test?
Well, we're telling everybody if they're in that group that you just described, even if they've gotten a rapid test, they also need to get in and book an online test with a PCR test. And if people are testing positive with the rapid test, as I said earlier, they are also tested and taken a swab, and then that goes to the lab for the more accurate PCR test.
Go ahead, Graham, with your follow-up.
Thank you. And a question for the Premier. In the first wave, you closed parks and trails. With the high toll that the pandemic's taking on Nova Scotians' mental health, outdoor activities have been seen as a way for people to cope, and trail use has really increased across the country. If things continue to worsen, would your government consider closing parks and trails again, or would such outdoor activities continue?
Well, that's a hypothetical situation, but the difference between the first wave and this one is that we aggressively in the first round shut our entire parts of our economy and communities down, and the mobility of citizens to be able to get on top of this. And this time, we're more focused and more concentrated on areas where there is potential outbreak, where we see here in Halifax. It's why we've been more specific on certain aspects of the economy and, quite frankly, social places where people would gather. And to all Nova Scotians, I will say this, and particularly on our trails and in our parks, they've understood the severity and the seriousness of this virus, and they recognize that's not a place to be social. Go and have your health, walk with your friends, your family. And they've been doing it by and large, keeping their distance and getting their exercise. Dr. Strang's advice earlier about how do we look after ourselves as well as we're going through this COVID. Those parks will be part of that, but I think we have said this all along, Dr. Strang. We will continue to monitor it and take any steps that we have to that we feel are necessary at the particular time.
I'll just add, wave one, we didn't know as much about the virus, so we shut down a whole bunch of stuff. Wave two, we know much more about how the virus is transmitted, so we're focusing our restrictions in areas that are high risk for transmission. Outdoor environments, et cetera, aren't a risk. So we unless it was absolutely necessary, those are things that are important to keep open. They don't create a risk, and as the Premier said, they're good for people's health.
Next, we'll go to Nabal Snan from the Chronicle Herald. Go ahead.
Good afternoon. So I was hoping you could help me clarify something. During Tuesday's briefing, it was announced that all attendees of a party would be fined $1,000 each, but the press release reads that stronger enforcement of illegal gatherings includes ticketing of all attendees, and then between brackets, total fine of $1,000. So will people be individually fined to a total of $1,000 per gathering, or will each person be fined $1,000?
Per ticket is $1,000 per person. So each. So beyond warning, if people are going to illegal gatherings, they may well be subjecting each person that's there to each of them having a $1,000 fine.
Go ahead with your follow-up.
Thank you. So far, the messaging on pop-up testing has been done through social media, and I've noticed a lot of confusion between people on that. I've seen people in the comments asking questions and random accounts answer them. So I'm wondering why the messaging has been scattered, and if there's a plan to centralize it to a specific social media account in the future.
So we're working, that's why I spent a fair bit of time today. We're working to make sure people understand, to simplify the messages, understand the different streams of testing. We're doing that on all our social media, et cetera. But you have to understand in this world, the leaders who are developing that pop-up program, Drs. Barrett and Dr. Hatchett, they're doing their own media as well. And lots of the volunteers are doing it. People who are waiting in line are using their social media. That's the way the world is. Well, we're doing whatever, as much as we can within our, the Nova Scotia Health Authority and the provincial government in terms of our communication, website, social media, to be as clear as possible.
Next, we'll go to Lindsay Armstrong from All Nova Scotia. Go ahead, Lindsay.
Thank you. My first question would be for the Premier. I'm hearing from some small businesses that don't qualify for the province's new COVID aid program who remain worried about their survival, particularly small retail shops in Nova Scotia, as you're encouraging people to avoid shopping and staying home. Last time when I asked you about small business support, you mentioned the federal rent program. I'm wondering what the province will do to keep small local businesses running, particularly retail and others that don't apply for this $5,000 grant program.
So one of the things in the first step here, the minister announced along with his colleagues in the Department of Business a program for those that we actually ordered closed. But we will continue to work with other aspects of our economy because you are right. We are asking people to avoid shopping unless it's absolutely necessary, do more of it online. So we'll get a sense of an impact of what that is, and the department is working on that now.
Go ahead, Lindsay, with your follow-up.
Thank you. This is for Dr. Strang. Regarding the staffing of public health nurses, it's my understanding that 100 public health nurses the province intended to hire in September. Of that, about 90 have been hired and just 45 have actually begun working. If this is the case, I'm curious what the holdup is in getting the rest of those nurses into work. And given the backlog you described today in contact tracing with our heightened numbers, do we have enough people doing that work? Do there need to be more hired?
So I'm involved in this at a very high level. For details, you'd have to ask the health authority. But first of all, there's been some challenges around getting people, and then once we get them in, they get them trained. But I see it as a success. We're halfway towards our 100, the numbers you've given. We have more to do, but it's not like there are people with their skills up to date, just waiting on the street corner for us to go get. The second piece is the challenges that public health is facing right now. They are like we did in the first wave. They're redeploying everybody within public health to focus on the COVID response and case and contact follow-up. Where they continue to the management team at public health continue to streamline and prioritize the work that needs to be done, and we are actively looking at ways we can bring in additional supports, whether it's through the negotiations with the federal government and getting support through their surge capacity program, looking at how we use other people in the government civil service that could also be redeployed into supporting public health as well.
Next, we'll go to François-Pierre Dufault, Radio-Canada.
Good afternoon. I'm wondering, it's a question that can go either to Premier McNeil or Dr. Strang. I'm wondering if and when the Atlantic bubble is recreated as it was before the second wave hit, would it be an idea to harmonize the practices in different provinces? I know New Brunswick uses a color code to identify the zones where there are more cases, where the restrictions are tougher. In Nova Scotia, we've talked about the HRM, a part of it being under tougher restrictions. PEI uses a color code as well. I'm just wondering, for the sake of everybody traveling back and forth whenever it's possible again, would it be an idea to have similar practices, similar codes in every province, so that you know, for when you leave one place and you go to the next place, you're actually talking the same language?
So I think we continue to work from the very beginning. I have regular conversations with my chief medical officer of health colleagues. We understand that to be consistent as much as possible, but we also have different ways, to some extent, thinking on how we achieve the same end. My approach is that we need to have greater flexibility and not set ourselves into a more rigid way in terms of having predefined steps that are taken when you hit certain parameters that put you in a different color code. We do a lot of work to have over the months to have fairly common approaches around how we deal with things like rotational workers, and we've lots of ongoing conversations about challenging areas like child custody, etc. And at the end of the day, we're all very much on the same page about what people need to do, regardless of what the the level of COVID-19, following the basic precautions that everybody needs to take. And so I believe we won't be fully consistent, but we really work hard to be consistent in the areas where it makes sense to be consistent.
And I think the approach that public health has been taking along with our government has been effective for the citizens of our province. As you know, we have a large urban center, like some of our sister provinces where they have multiple urban centers, the rural parts of our province. But public health has been communicating directly with Nova Scotians, and this has been an effective way to work with them. And we'll continue to do that as we cooperate with our sister province here in the Atlantic region.
Go ahead with your follow-up.
This one might be more directed at Premier McNeil. You mentioned in your opening comments that there is noise, rumors going around on social media, and you would like to fight that and channel back the information to a credible source. I'm wondering, what's the best way to go forward with that?
So first of all, I would say to Nova Scotians, continue to follow the coronavirus website, and I just caution everyone, first and foremost, let's continue to do what we've been trying to do from the very beginning, be kind to each other. If you don't know something is factual, don't repeat it. And I think all of us have come to learn, because it's on social media doesn't mean it's factual, doesn't mean it's true. And I just ask you all to realize these are not abstract objects out there, they're human beings. That we're potentially talking about. They got loved ones, they got families, they've got community. They're in a community. It's a community. Let's be mindful of that. We've done a great job of looking after each other. We've done a great job of keeping this virus as best we can at bay. Let's do that as we continue to do that, even as we're going through this second part where our anxiety is getting up a bit more. Let's not lose sight of the humanity that we've demonstrated towards one another in the last 8 months. And I just ask everyone to continue to practice kindness.
Can I add to that, Premier? Your answer reminded me, I saw, it was a tweet today by Dr. Theresa Tam, and it was talking about this and misinformation, and she quoted a 13th century Persian philosopher, and it basically goes along the lines that there are 3 gates that your words should pass through. First gate, is it true? Second gate, is it kind? Third gate, is it helpful?
Next, we'll go to Tim Bousquet from the Halifax Examiner. Go ahead, Tim.
Hi, good afternoon. I wonder if you can update us on the situation at Auburn High and Graham Creighton. Are there any new cases associated with those schools, and has everyone been tested and with results? And has the experience there given you any kind of new information or lessons, I guess, that you'll take forward to Bedford South?
So we have looked at all the close contacts from both the first 2 cases at Graham Creighton and Auburn High. Today is their last day. They've all been tested, and we've had, other than the one student who became the second case at Auburn High, no other close contacts have tested positive, and today is their last day. The close contacts from the second case, Monday is their last day, and none of them they were all tested, and none of them were positive. We certainly have learned some lessons, especially on the communication side, and I know, talking with my colleagues in the Department of Education, that our communication and the interactions between public health and in the education colleagues were smoother when we had the high school in the Canning area. We knew that the first time we went through this, it'd be a little bit bumpy. So every time we go through this, I think it'll become smoother, especially as we work through some of the complex communication with schools, with families, with teachers.
Go ahead, Tim, with your follow-up.
Yeah, on the pop-up testing, you spoke to that they're less accurate than the standard testing. I'm wondering if you're putting some numbers to those. There's been a handful of cases identified as positive at the pop-up testing, and are those people, when they get the standard, are you tracking if they're accurate, and are you developing some sort of feel for the accuracy locally as opposed to just numbers out there in the world?
Absolutely, that's part of the people that are doing this. They both, especially Dr. Barrett, comes from a research background. She's certainly applying a research lens to all this work and looking at things exactly like you said, comparing the ones who are positive. How does that compare when we retest them with the accurate result? So we are applying a research lens to all this as we need to be. We're learning from this. Nobody's ever done this before in this way, so we need to learn from it and share those learnings with the rest of Canada, but also making sure we're capturing those learnings. So next time we have to do this, we can do it, adjust it and make it even better.
Next, we'll go to Kyle Shaw from the Coast. Go ahead, Kyle.
Thank you. There's a different type of misinformation, but it's misinformation still. I'm hearing confusion from people about the timelines on how exposure and incubation and testing works. And, in other words, there's some question if a negative test on Wednesday definitely means you're negative on Friday. So, Dr. Strang, can you explain a little about when people can feel they're in the clear after a potential exposure, and if it makes sense to do repeat tests in a 2-week period, the way that university students had to in August and September?
So, it's about testing capacity. The first thing is when people have had an exposure, we want to make sure, and they're identified based on the public health judgment, that they're what we call a close contact. The type and the length of their exposure puts them at a significantly increased risk for actually having acquired COVID-19. We test them, but then we also say that we isolate them for 14 days. And the reason we do the initial testing is to make sure that they're not already positive, and then we isolate them for 14 days, even if their test is negative, to make sure they don't turn positive in that 14 days. Could we be doing multiple testing? Yes, but at the end of the day, with the limitations, even with a PCR test, you have to have somebody quarantined for 14 days. A 14-day isolation or quarantine period is actually the best way that you make sure that people are not becoming infectious and then exposing others. So doing more testing on individuals wouldn't remove the ability to do that 14-day or the need for that 14-day isolation period, and then we'd be doing testing on somebody and not being able to test new people. So it's a very strategic way in which we, even though we're building substantially the board here at capacity, we need to be very strategic and using that in the most efficient way.
Go ahead, Kyle, with your follow-up.
Okay, simpler question. Will the 5-person gathering limit be in place until after Christmas?
So we've said it's for 2 weeks. All the restrictions are for 2 weeks, started on Thursday. I think it takes us to December 10th, and we'll review that. I'll give no guarantees one way or another. We'll get towards the end of the 2 weeks, and we'll reassess. It may need another week. It may need 2 weeks, but we'll work through that when we get there.
I think all of us should plan that this holiday season, this Christmas season, will look very different than it has in the past, and find unique ways to share with the people we care about. I know we're already making plans to change ours, and I would encourage all Nova Scotians, regardless of what the number is, find a new and special and unique way, start a new tradition on how you will connect with your family and people and your friends and loved ones safely.
Next, we'll go to Jean Laroche from CBC. Go ahead, Jean.
Good afternoon, Dr. Strang. I'm wondering, in terms of ventilation in schools, I know we've been keeping the windows open, and that's great, but it is going to get a lot colder. In Quebec, I know they're using air purifiers and they're installing air filtration systems. What does the science say about whether or not that's useful in terms of COVID?
So I think it would be like a lot of things. It's just one small additional piece. I know what we've done here in our schools is looked at all the ventilation systems, and the schools have assured me and the Premier that they've all been reviewed, that they're functioning to maximum capacity. I just remembering, and also along with, we have a multi-layered approach. Ventilation is only one piece. All the other measures, from staying home if you're sick, health screening before you come in, hand washing, masking where appropriate, cohorting in the elementary schools. It's a multi-layered approach, and all those, there's no one barrier, if you will, that's going to solve everything, and you have to have a multi-layered approach. I think adding those air filters and stuff would be one other piece. I'm not aware of anything that would suggest that they're going to solve all the issues. I think the approach, what we have in place in our schools, shows that our schools remain safe. If things change, then we have the ability to shift to go into the blended learning or full learning from home. The fact that we had some exposures in some schools, and the people that have been exposed have all come back negative is again a sign that what we have in place in school is working.
Go ahead, John, with your follow-up.
In keeping with the teachable moment theme, if you will, the house party that we've all reported on extensively in the South End, can you tell us, again, it would probably give people a better understanding of how one event can have serious consequences. How many people do you know have tested positive as a result of that one party?
So I'm not aware of any cases being linked back to that specific party. I have seen some correspondence between some individuals, some neighbors, and some of the people who hosted the party, and the claim is that everybody at the party was tested and is negative. I don't know how valid that is, but nothing's been brought to my attention from public health follow-up that would link back any cases to that specific party. But we have had other cases who've clearly their attendance has been in other large parties, along with going to multiple bars, etc. So certainly we know that these large private parties are playing a role in driving transmission and creating cases. That's no surprise.
Next, we'll go to Jesse Thomas from Global. Go ahead, Jesse.
Thank you. Question for the Premier regarding the vaccine rollout. We heard earlier today that the Prime Minister said former NATO commander Major General Fortin will lead Canada's vaccine distribution efforts. I'm just wondering who will look after the plan and the rollout here in Nova Scotia, and what might that rollout look like?
So public health will, as you know, we do have an immunization program every year that we would roll that out with flu shots. They have an actually very well-oiled machine. We did get a call, or I did receive a call from Atlantic Command, I think all Atlantic premiers did, offering support. But it will be led by public health with the support that they require, and the Atlantic Command was very gracious and generous and just offered to provide any support they could. And we've kept the lines of communications open with them and public health, and we're working now to make sure that as we wait for the vaccines to be approved, that we have built the capacity in our province to mobilize the immunization program.
Go.
I'll add to that. Within government, we certainly, that my team, as the Premier said, we do this every year with flu vaccine. This is bigger, and we've certainly have developed a process. We're getting all the support we need from people from the logistics supply. Deputy Fred Crooks, who's been leading the work on all the PPE procurement, him and his team are now moving alongside, working with public health and giving us all the logistics support as we start to work into the details of rolling out a vaccine supply. We have strong relationships with the health authority and other healthcare, other parts of the healthcare system to engage them as necessary.
Go ahead, Jesse, with your follow-up.
When it comes to prioritizing or administering the vaccine in the early days, who sets the protocol as to who gets it first? Is that something we still want the federal government to lay out, or is that going to be up to the province to handle?
It is my hope that it's consistent across the country, and that it is actually not the politicians doing it, it is actually public health. They know the science behind how we should prioritize this. I think Dr. Strang and I have worked very hard over the last 9 months to make sure that he was allowed to do his job as our top public health official. His advice around the issues around this virus are ones that I take seriously and our government takes seriously, and it will be public health that I will be leaning to get that list. But I, as Dr. Strang said earlier as well, I think it should be consistent across the country, and it should be our public health officials who set that target.
That's all.
You want me to add to that? So, as I said in my remarks, we have a National Advisory Committee on Immunization, who is a long-standing body, vaccine experts, a range of expertise. They advise provinces and territories and the federal government on a range of vaccine issues. I sit at the Special Advisory Committee for COVID. The National Advisory Committee is doing work, and they've identified a list of priority groups. They're now doing further work to prioritize within those groups. That all comes to the Special Advisory Committee, all the Chief Medical Officers of Health. We approve that, and then it goes forward for further discussion of deputy ministers and ministers of health. But we from the Special Advisory Committee provides those recommendations about this, and we are clear that that'll be what we bring forward in each province and territory, and we're working very hard on maintaining consistency about prioritization.
That's all the time we have for questions today. Go ahead, Premier.
I know Dr. Strang talked about our young citizens at the beginning, the 18 to 35-year-old, but I want to take a minute to speak to you directly if I can. You are a very social group, and I know that we've asked you to stay home and keep your distance from your friends. It hasn't been easy, but you're doing it. We've asked you now to get tested. We thought maybe a few of you would go. Instead, thousands of you have showed up. In just 6 days, if you count all streams of testing, we have conducted over 13,000 tests. A vast majority was you. You stood in the cold and in the rain. You stood for hours waiting to get a test. Not because you were sick, but because we asked and you took responsibility. I want you to know how grateful I am and how proud of you I am. You are the future of our province. By showing up and stepping up, you are protecting everyone around you and your community. And that's the best example of leadership. I want to sincerely thank you for what you've been doing. And to everyone, have a safe and quiet weekend.